And also, the University of South Australia is a #1 university in industry research income because we have a very close connection with industry research, and we produce research for industry, and then we have a real world impact. And also, the University of South Australia, we provide more formative education experience for our students with this focus of contemporary teaching method and commitment to delivering the program that both industry relevant and academically rigorous, and that what the important thing is to the research and education are linked with the industry. And that's why we is one of the best university in Australia. And now our university and the University of Adelaide, where I got a PhD, and we're going to be one university in 2026. And this wonderful things to have in history of higher education sector. And the world is watching us to how you're going to amalgamate two larger universities and encompass nearly 60,000 students. So we are one of the huge university, and the nursing program we have 1,000 students per year, and totaling 3,000 for the 3 years. It's a 3-year program, and we also have a 250 postgraduate students. And I'm one of the postgraduate coordinator in nursing. So this is about us, and also our research group is mental health and suicide prevention research and education research group. We have more than 20 academic staff, and some are lecturers, some are research only staff. And we have a professor in mental health, and we have only one professor with the mental health. And I closely work with them and produce in industrial relevant research. So, and also impactful research, and we are actually looking at more real world challenges faced by those living with mental distress and and also their caregivers, because the people who care for the mental people with mental condition and also affect their mental status. We're looking at the best available evidence how to incorporate and improve their life through this the research and training, and also the education. And also we are actively involved with the policy development. That's why we attract a large number of grants and publication and track records to the university. And also our staff contribute directly to the teaching of the undergraduate and postgraduate program, and equipping the students and all other healthcare professionals, including other pharmacists, physiotherapist, and sports physiologist, and they need to be skills and knowledge to require to effectively help people experiencing mental illness and risks of suicide. So we use research and also teaching, and then combination to make a more meaningful contribution to the both teaching and research. So this is very important things to remember the international universities and to high rank university. And in Sri Lankan universities also need to consider that avenue with the relationship with research and education, and also wide impact research and industrial relevant research. So I want to share some of the approaches what we actually do. So we use evidence-based approach to we guide our research, and we use a process called evidence-based practice. I think everyone know about that. And where we use evidence from the research evidence, and also incorporating with the clinician expertise, and also we consider the patient. I think there's a microphone there. Someone speaking. I don't have a such facilities, and someone can switch off the microphone. Priyank, can you switch off the microphone?
Hello.
Yeah, and the
Yes.
sound, background music, background sounds.
Yeah, there are so many backgrounds.
Okay. Right. That's okay. We start again. That's the we use evidence-based approach process that combine with not only just research but also incorporate your experience and clinician experience. It's very important when you implement mental health practices because they have a long year experience and also we consider patient preferences and values. And one of the aspects is we now have a lecturers we call lived experiences lecturers, and they have a previous mental condition, and then but it doesn't mean they cannot um, um, aspire their experience and their educational opportunities, and some of the people actually have a mental condition, they earn a PhD and they're teaching, and also some are clinician, they have a mental condition. The other those people have best to use for the teaching and research, and because they have a first-hand information with lived experience. So how we have a lecturer in lived experience in mental health, it's really contribution, valuable contribution to us to improve our education and also research. So and also we utilize the evidence-based practice process and developing research question and looking for research evidence and also critically appraising the evidence to check the quality of the evidence and also apply the clinical situation and also decision making and also developing a policy related to the mental health and then finally analyzing and then we start again. So this is the process where we can widely establish evidence-based practice process. We use this approach to our research program. We call program of research and also training programs, education research. And you may be aware that the best available evidence, where it's come from, and the highest quality evidence come from systematic review where of randomized control trial. Because in the medical sector, we're looking at the interventional effectiveness. So the best way of getting that is from systematic review. But sometimes we cannot conduct systematic review because there is no enough primary studies. Therefore, we need to conduct primary studies, such as randomized control trial and other observation studies. Sometimes some ethical reason we cannot do the clinical study, so experimental type study design, especially in the mental health, people with mental condition. Sometimes we need to use expert opinion and your experience, clinician experience, medical doctor's experience, and also patient preferences, and also census statement as the best available evidence. So in some condition, especially for people with mental condition, it is not easy to obtain ethics approval to conduct a study. So that's one of the reasons because they are one of the risk category we identified and to comply with the national statement of ethics conduct. So we conduct some of the research in mental health, people with mental condition, and we rigorously use the process to safeguard their rights and not to any interference with the existing medical conditions or mental condition. And that is one of the target area we consider to when you're doing the research. And I'm sure I'm not going to explain more about systematic review, but we use systematic review approaches and also primary research, not only systematic review. But because the reason is the large number of studies already published in databases. I'm pretty sure you can access to the Medline. You see the million of citations, nearly 29 million papers cited in just Medline alone. And the last year they added another millions of citation, and each day is hundred of randomized control trial published in many journals, and very difficult for clinician to keep up with their knowledge around interventional studies and the research evidence, and which evidence they want to use for the clinical practice. This is a big question. So systematic review utilize more reproducible method to combine primary studies, make more accurate conclusion regarding the effectiveness of the intervention. So this is one of the great area to understand the systematic reviews, and then that help to develop the clinical practice guideline. In Australia, NHMRC, a National Medical Health Research Council, and required to all the clinical guideline developers should utilize the systematic reviews. In my PhD, then I actually excel my research methodology, both primary and secondary research, especially primary research and secondary research is a systematic review methodology developed, and then that's why they are one of the academic and systematic review specialist in NHMRC. That actually helped me to get 3 major research grants to developing Australian infection control guideline and other several guidelines. And we recently got another large grants with suicide prevention in Australia. So this is how we manage both teaching and research and use the approach. And I want to give that way because you can learn in your PhD. I'm sure some of you may already complete a PhD or doing a PhD. So to develop a specific specialty or a methodological expert in the field. So I developed my expertise in methodologically, there is a systematic review and randomized control trial, and both are very important to developing clinical practice guideline, and that's really useful for getting grant and publication. Okay, that's the message from this, and I want to share some of the research I specifically doing in the mental health and suicide prevention. And I summarize only the main area where we conduct research and only relevant to the mental health. So if you look at the, you already know that some of the psychological therapy, like cognitive behavior therapy, help to reduce the depression. So if you develop the research question like, what is the effectiveness of CBT compared with antidepressive medicine for the people with depression? So in this case, if you look at the why we need this alternative therapy, like a cognitive behavior therapy treating people with depression, we just look at the Google Scholar, and if you type this question directly, you see the large number of citation, and it's nearly a million citation. It's just one topic. So look that way, and then to considering this all the published data, we developed the project because project around the depression and suicide, and also what treatment strategies are most effective. So every year, more than 700,000 people take their own life, and there are many people attempt suicide. Every suicide is a strategy, that affect families, communities, and entire countries, and has a long-lasting impact on the people left behind. That's one of the bad things in society. And suicide occurred throughout lifetimes. Any age can occur, but we found now the young adult is one of the prominent group in commit suicide and take their life. And many years ago, the old adult are the highest top group, but now it's taken over by the young adult. So looking at that evidence, and the educators and the policymakers and researchers should consider that target group and why actually they commit suicide. And that one of the reason is a mental health problem in the country. And if you remember that a decade ago, the Sri Lankan suicide rate is the #1 world, it's the highest level. Now I think it's reduced to some reasonable level because of some economic development, but not sure with the recent economic problem with what actually the mental status and the suicide. And then now it's a time to think about the people with mental health and how we tackle the problem and the socio-economic crisis. It's not only just for Sri Lanka, but also in other countries. And I have seen today that Australia interest rate is going up again. So it's difficult for people to live in the current situation, and with world wars and it's taking place, and then more than ever now we need to consider the mental health status of people. And in Sri Lanka, including Sri Lanka and other many middle low countries, they have only 77% of global suicide occur in that countries. And mostly the pesticide because of the agricultural area. And they I read the several papers published in Sri Lankan academics and researchers, and it's interesting papers. What strategies they took to potentially minimize the minimizes suicide rate. But some of the strategy that work, especially the pesticide limitation, and if you look at all the papers and the published guideline about Sri Lanka and the suicide prevention, some work actually, but some not. So as academic, you need to consider where that the prominent key priorities in this area to develop your own research. And also depression increases the risk of suicide, and the depression is one of the key indicators for the suicide. And because of that, depression inherently have a sense of helplessness, and emotional pain associated with depression can become overwhelming and leading some people to consider suicide as a way of escape their suffering. And also suicide thoughts are symptoms of severe depression. You know, the depression is mild, moderate, and severe. But suicide thought is considered as a severe depression. When these thoughts are present, it's important to understand, take them seriously and seek professional help. If someone talked about about this suicidal ideation, and as a healthcare professional, and you need to consider, and it should take seriously and refer them to the professional help. If evidence shows that professional help significantly improve the condition, because that is the key point where you need to consider someone talk about the suicide and then and about the depression, and that is one of the key indicator you need to look at, and don't take it easy that because that is the one of the reason, and they commit suicide actually make their own feeling express before making suicide in most cases, because we have a forensic analysis of each suicide happen and why it has happened. And we noticed that there are many people who take their life, and they try to contact the agencies relevant to the suicide prevention, and at least they try to talk to a friend. So that is one of the key indicators, and so I need to look at. So in my research, and we look at especially the cognitive behavior therapy. So one form of psychological therapy is widely used, whether that can reduce the risks of suicide in with depression. And the reason is the cognitive behavior therapy is there is no side effect on that. Because if you know that the antidepressant medicine is the frontline treatment for depression. So mostly the people, and I work in Sri Lanka as a mental health nurse many years ago, and the medical professionals, psychiatrists, they always prescribe medicine, antidepressant medicine, because of the risks of suicide. And then that evidence shows notably that antidepressant medicine reduce the suicide rate. However, some people reluctant to take medicine, especially old adults, because of the reason is with age they have other physical illnesses like diabetic hypertension and other cardiovascular condition. They require a lot of medicine. It's like a polypharmacy. Then some of the antidepressive medicine interact with cardiovascular medicine, so have some unwanted side effect. So therefore, we review the papers and we develop systematic reviews around the best strategy. How effective is CBT for whatever is depression? Those who cannot use antidepressant medicine, and we review the papers. We identify 7 randomized controlled trials around that, and it shows the CBT is one of effective treatment strategy, and sometimes can be used as similar as antidepressant medicine, but for people with mild and moderate depression, not the severe depression status. So, and our evidence shows the CBT and its effective treatment for old adult with depression. And the evidence shows that. And when we use the evidence-based practice, so we utilize other 2 methods to understand their experience, especially old adult. We interview old adult with depression, those who use in CBT, whether how they feel about this intervention, whether they're useful, and then what strategies they need to improve the condition. And also we interviews and a focus group interview with clinician, those who use CBT use CBT technique for old adult with depression. And we published this paper in a conference in Singapore, and especially the clinician and consumer review. Then we combine with the systematic review findings and the qualitative studies finding together, and we produce recommendations to the South Australian government and Department of Health to improve the mental health of the people old adult with depression. And then we make major recommendation, and it's published in 2015, 7 years ago. Now, the CBT is considered as a Medicare benefit, and that mean in Australia, and the Medicare is the universal insurance to buy the medical bills. Therefore, someone will take CBT as a treatment, and they can claim for Medicare insurance. So this is one of the good things. It's only the psychological therapy that the CBT can be used as Medicare claimable. So this is real world impact, and then we produce several other research projects similar to this, including also we look at in another project is published in one of my students in their master degree, and the social connectedness to preventing suicide among old adults. And in Australia, especially with age, the more likely people go to the aged care, and then have a limited access to the social fabric or relationship, their relatives, their friends, and that increase their suicidal behavior, suicide thought. And in compared to the people living in the community, some people don't like actually want to go to the aged care. I'm not sure in the Sri Lanka situation where the old adult actually living with their children and the actual mental buffer, and it's a protective factor rather than actually they are put into the aged care. I think that Sri Lanka is one of the good example, and caring their parents is prevent depression and suicide. Right? Some people think actually the grandparent and they look after their children. They know life other than the grandchildren, but it's something that's protective factor. I remember that one of the research study is conducted in our research group is to childcare and aged care. They connect each other in the same premises, and then because of the children learn from old adult, they have a time because their parent don't have a time, but their old adult have a time. So and an older adult they have a time because they can interact with children. So that project has worked very well. And there are some limitations, however, and I think that the exact model we have in Sri Lanka, we're fortunate to have the parent in Sri Lanka. And but it's still the urbanization and that's something that now is increasingly is age capacity of Sri Lanka and can lead to social disconnectedness. So what we found in this research and especially the intervention promoting social connectedness, they reduce the depressive symptoms and improve the resilience and allow connectedness beyond the individual level, and that potentially reduces the risk of suicide. So, and this is a very valuable contribution, and we are working on another research plan, and especially introducing the special intervention with social relationship and how that improve the mental health status of old adult. So these are the one of the area we consider in the current research, and also, and then another new area is our research include trauma informed approach to suicide prevention. Because of the trauma informed approach is it's one of the uh, important area where because evidence shows the impact of effectiveness of these intervention and strategies, especially suicide prevention Australia. This commissioned this study. It's one of the big organization about developing policies around suicide prevention. And we found the significance of this such approach and its influence on suicide prevention effort. And trauma informed approach, it may be new things to some of you, but this approach acknowledges the widespread impact of trauma on individual and communities, and it's recognized the individual with history of trauma, including some childhood experience, and they are at risk of mental health challenges and including suicidal thoughts and behavior. Especially need to consider that, right? That if you work with children and the young adult and that their childhood trauma, right? And you see the rape rate and they're in the children, especially female, and then that can potentially a negative impact on their later life. It's very evident, very clearly show that the previous trauma can impact the depression. And these trauma-informed strategies prioritize the creation and safe and trustworthy environment and establishing the trust between service providers, nurses, or the other providers, and the patient, the need and essential to effective suicide prevention because that is important thing. You need to build a relationship with the client or consumer. Otherwise, they're not going to tell you the story. And remember that. And as a professionals, and you need to keep that confidentiality important. That's why how you build the trustworthiness. And also, the trauma-informed approach is more away from blame to each other people, and that's common practice. If something happened and then you blame to other people, and you're not going to find what happened actual situation. That is one of the problem in our society today, not only just Sri Lanka but also in many other countries. So, and the care provider recognize the role of the trauma that shapes the one experience and aim to replace the judgment with empathy and understanding. I think everyone knows about what the empathy is. And also care provider are trained to be sensitive to potential, because when you talk about this trauma, there's a potential to re-traumatizing the experience. So we need to be very careful about that. And also trauma-informed approaches recognize the role of cultural factors and shaping their one's experience trauma and mental health. Because of the cultural, it's called the mental illness is the stigma, and people don't want to declare or talk about the mental condition, or they may have, or their community, or their relatives or friends they may have. And also the incorporating a trauma informed approach into suicide prevention, it can significantly improve the impact addressing the underlying issue related to trauma and promoting resilience. It's very important, the term resilience, because the people with trauma is have some limitation to adapt the situation, the new situation, because of the trauma situation. And then they want to empower to understand the situation and to empower taking the next step and moving forward and um, and shaping their life with adapting to the new environment. That's called resilience. And also, it helped to create a more supportive, empathic, and effective environment for individuals with risks of suicide. So that is one of the valuable contribution we made through our research teams to the working with the Suicide Prevention Australia, and we developed this strategy and to improve the practice, and our team is currently working on the different type of project with suicide prevention strategies, and that how we develop the research and then also link and whatever we learn from the research and directly apply to the undergraduate and postgraduate programs. And because we have a mental health course at the first year of the BSc nursing program, and also Bachelor of Midwifery program, because the midwifery is a separate profession, but we in the same school, previously School of Nursing and Midwifery, and also my position come with the same lecture, nursing and midwifery. But we have a professor in midwifery and professor of nursing, and also similar way, I supervise nurses and midwife both in PhD and master level. So especially with we work with midwifery and postnatal depression, because we developed the antenatal care guideline. One of the area is to postnatal depression. I work with my midwifery colleagues to understand that further about this research. So it's very important to consider that it's really neglect area in this maternal health. And I think if you are academics and also a lecturer or a researcher or students, and we need to think about the way of the, the role of academic in preventing suicide and improving the mental status of young people, because we need to consider the young people mental health. And I think the schools and the university academy play a critical role in preventing suicide among young adults, and their influence extend beyond the classroom, and they can have a significant impact on mental health and the well-being of students. Some of the key strategies are mental health education programs and a rise in the awareness about the sign of distress, coping strategies, and available resources. And in other way, it can help to reduce the stigma, encourage daily intervention, and also identifying at risk of students. And if we close the link with the students, and then we see that, and you can identify the sign of the risks associated with um, depression, anxiety, or suicidal thought. And also you can create a supportive environment, and it's called a non-judgmental classroom environment. It's essential to discuss this point. And also providing resources for students, especially counseling services. I think the university establishes a separate section. And when we identify some of the troubled students, if they have a life, because it's, and in Australia, some of the students, and after 18, they actually live separately. Sometimes that create unwanted other mental problems if they addicted to alcohol or drugs. And we interview some of the students when they shows some of the risk factors. We talk to them and we refer them to the mental health clinic or confidential counseling services provided free from the university. So that's a great things provided by the university. And also we need to promote the self-care, and need to encourage you to prioritize self-care, stress management, and work-life balance essential. So, and the self-care is important because if you don't have a self-care about yourself, it's very hard to say someone can care about the patient. So it's very hard to maintain that self-care because if you committed to work environment and very challenging work environment, especially for the academic, and sometimes you miss the self-care. So I think very important to keep in mind that. And also mentorship with that relationship enhance the mental well-being of the students, and can offer guidance, encouragement, and safe space for students to discuss with their concern. So I'm aware because of the Sri Lankan system and the university, and it's very hard to reach academics to discuss their concern. And here, actually, a lot of students actually come to talk about their concern directly with academics because, and the distance between the academics and students are very slim because of the that's why have we worked together. So in the beginning of this one, my journey as an academic is a bit harder because of my background from Sri Lanka. But now we subsequently adjusted to life. We do not expect from respect from the students, and then but we work like colleagues and the friends, and much better and more comfortable environment. We can share things like the education and the learning process. Actually, I really enjoy that way of teaching, to work with my undergraduate and postgraduate students. I always have very positive feedback in my, because each year we have a students evaluation. The students can post anything to the university system, and especially positive and negative, and comments about the lecturers and course and the university as environment. And also need to have a collaboration with support services, especially counseling, on-campus counseling services, and also having awareness campaign about mental conditions. And so therefore the academic in the school and the universities have a unique position to influence the well-being of young adults, especially children and young adults. And it's really helped you to consider to develop strategies appropriate for preventing suicide and improving the mental status. And also, you can consider improving your academic life and also your mental health. This is a very difficult area to think because of Some of the strategies we always ask, and the work-life balance is very hard to maintain. And how are you going to do that? And because of the your unique position as academic or researcher, and that have a challenges everyday life and as academic, because it's not only just a teaching but also research and also how you manage with people, other people. It's very difficult thing. But work-life balance, without that, and you cannot progress, and otherwise you burn out earlier. So I encourage academics to establish a very clear boundaries between work and personal life and promote the importance of taking time off and disconnecting from work-related tasks during non-working hours. Because and we do not answer the questions after 5 p.m. We do not answer calls or even they check the mobile. And some students have some distress, and then they have a ambulance and police and other supportive services they can actually safely can contact rather than the lecturers. What happened if we have 1,000 students? We share with them our personal details, and then we can't do anything. So because of that, after your workload is your time is finished, and you take time and during the Christmas time and take a break and then disconnect from work. And during the Christmas time here, and we have only 2 3 weeks. I'm I'm not going to do anything around that unless our important research project is ongoing research project. Sometimes we cannot stop, but unless otherwise, I'm not teaching. So in my work-life balance, I have also problem with how to manage this, considering all the workload as a senior academic of the university. But I teach only the first half of the year, and then I do research in the second half of the year. Sometimes we need to mix, but I do not teach the second half of the year. But research are continuing process, and we can't stop. But if you teach whole year, you don't have time to do research, right? And also to take leave and take a rest and then make a life balance. And also workload management is also linked with work-life balance. And the senior academic staff and the dean or the vice chancellor should consider to implement a fair and manageable workload, recognizing the excessive demand can contribute to burnout. Right. And other thing is flexible work arrangement. If you work from home, now because of the COVID, give you as another chance to rethink about the work environment, and then and most people work from home. I know some of the engineers um, they work from whatever doesn't matter really, because they're network engineers. They can work into anywhere in the world. They can work from home. Sometimes they go only after 6 months or 2 times per year. And it's flexible work environment. But a nursing or other healthcare profession, we can't do that. But at least arrangement flexible working environment. If you allocate a day for research, and you're not going to teach or you don't want to come to the university, then if you can have a flexibility. So in the second half of the year, I discussed with my line manager. Then I work from home. Actually, I come to every day because of my office environment is better for conferences. Otherwise, I work from home. I have a similar work arrangement with similar computers and internet connection, but it may not be a good option to Sri Lanka. I'm not sure. However, we can consider the flexible work arrangement and also and stress management programs and relaxation technique and whatever is based on your faith or your religion maybe have, or otherwise you can implement some of the training programs and I mean we have our group meetings and some people say in the I can't go to the Friday because I go to the temple on Friday, but and other people go to the club. They enjoy. But we have a research group. Sometimes we meet every month in Thursday afternoon, right? And that's actually reduce the stress. We talk to people, and that's the good thing. Rather than email your senior or colleagues, I'm better meet them. And also peer support network. If I think that it really work well in Sri Lankan system, because I now feel the same way. And what is the difference here and Sri Lanka? When I work as academic in Sri Lanka, there are a lot of people and friends, and here less than that, because we work in mostly using internet and Zoom or other online way rather than actually talking to people. And I rarely seen someone with my corridor here, and then, even with the working days, is something negative impact. Um, and also, peer support network is important, um, and if you can allocate a well-being day, go with your peers with somewhere and the trade for something that can help you to uh, make a relationship, and then the friendship and the cooperation with others, and to make improve your production. And also mentorship with the supervision of your senior colleagues and the junior colleagues, and mixed with their shared experience, and really an important thing. And also clear expectation and communication. You manage this to reduce your mental health, and and you don't try to respond or every email on time, because of the, and take some time to, at least because of the my experience shows, it's better to talk to people rather than email. I ring them mostly people to talk, but sometimes we need to ring. I am receiving hundred of email per day. It's very difficult to promptly respond. But I told the students, and please take at least 24 hours to reply back. Otherwise, the students are sending 100 of email per day. Yeah, we're not going to work. I'm not checking that email and then after work hours. But sometimes we have to, it's in some cases, but we try to reduce that way to, otherwise it's not good for the mental health. And also recognition and appreciation. Everyone is happy to receive the recognition and appreciation. And because the positive feedback and acknowledgement can boost the morale and motivation. And also physical well-being is one of the important things, is regular exercise and the balanced diet and adequate sleep. Sleep is the biggest problem. Even I have some problem with sleep because of the other commitment. And however, you need to maintain that. And there are a lot of other technique and then apps that can link to well-being of your physical and mental well-being. So supporting the mental health and well-being of academics is not just benefit for the individual, but also contribute to healthy and more productive academic environment. So these are things I need to mention. And I also look at the important documents, it's policy documents published around the mental health, especially the policy document Sri Lanka Medical Association. They developed in 2019. It's a really good one. And then I suggest the academic, those who work in the mental health sector, to look at the suicide prevention in Sri Lanka and recommendation for action. And also that's called National Mental Health Policy, 2020 to 2030. I also give the policy indication to where the national priorities are. So these documents are provide very important recommendation to improve the mental health and suicide prevention. And I suggest you to consider their priorities and develop relevant program of research and intervention to improve the mental status of the nation during this difficult time. All right. Thank you very much for listening to my session. And this is my email address. And if anyone have any question, and please email me, or otherwise you can directly ask at the time. Like, I think we have 5-10 minutes.
Yes. Thank you, Dr. Jayasekara, for very informative and impressive presentation on timely, valuable topic. I believe your highlighted facts may valuable to audience as the problem is currently it's a trendy topic in Sri Lankan context. Currently, Sri Lankan university system also has identified the importance of mental health and suicidal prevention as a prime objective. Your contribution here may impress you for the audience. I think this is the time for questions for clarification with the presenter. Audience, do you have any questions? You can raise now. Yes, Dr. Shant is having questions. Yes.
Thank you very much. It's very timely and very important presentation. Thank you very much. Actually, we have a program for youth development workers. It is called BA in Youth and Community Development, offered by the Faculty of Humanities and Social Sciences. Now, the biggest constraint coming from the family, the family, parents, and especially with reference to they try to motivate their children for education, maybe school or other higher education, or kind of a stress at home. Or there are some parents, probably they are unaware of kind of adolescents and youth, what their mental kind of conditions or behavior. They are unable to even provide the adequate love and care which suits to adolescents and youth. So, Professor, I think now this seems to be every A-level, low level. Once we release results, every year we can see many even bright students. Once we release results, we also get a few cases due to failure, and they are unable to cope up with the stress coming from parents. So could you elaborate a little bit of this new research or new way of approaches which we can inform our learners and also research teams?
Dr. Jayasekar, you are muted.
Can you hear me?
Yes, now.
Okay. Yeah, that's an important question you asked, and because it's really dependent on the culture, and because of the Sri Lankan and Southeast Asian countries, and the education see as the only way to uplift their economic condition. That's why everyone trying to. We can't find a fault. We can't find a fault from parent, but they need to understand the level of pushing their children to that way. Not always possible, everyone to get that level, to be a doctor or engineer, to be aspired by all the families, but in reality, it can't take that level to the one challenge is that the lack of educational facilities in Sri Lanka, because here, we can't compare two countries, but different economic situation. But look here, if someone take high school, they have options available. And that one thing is to go to the a professional, like a medicine doctor or engineering or architect or other health sectors or whatever. And other people go to trades like a technical school. And here, there's no discrimination against anyone. Now, these days, and we're looking for a bricklayer, and very hard to find someone. And the traders earn money than a professor, if you believe or not, because that the one thing is economic development, and everyone is same. And that creates the society believing that anyone happy with their situation, education, or their job, they're happy and they're happy. So, and that's a different context, cultural context here. And even in Sri Lankan community living in here, they do the same thing with what you do in Sri Lanka. And they push something. But children are different. Here the children they learn and they directly say, I do whatever I want. So sometimes we know the way to do that, but it's better for them. They want to do what they to be happy. Happiness is important thing, but I can't see the real solution. But awareness is important to everyone to understand the existing situation and the level of the aspiration. And if the parent can't reach that level, it's not fair for children to do the same thing. Even the medical doctors or specialists, their children may not reach that level. We need to understand that. And that understanding, awareness, and is important thing. And because if you consider as a one group of people, or for example, if you go medical doctors or engineers as a group, that's the highest group, that is the created problems. It doesn't mean that we don't want to respect them. And it doesn't mean and to push everyone to be a doctor over things, and that problem create and it's not just a family but also economic creation of the society. So there's no single solution for that. But I think the teachers from the primary school to higher education, they have a significant role of shaping the future of the society. And I think that one of the key things, and we can't change the people like us, it's very hard. But students can be changed. Right. And it takes some time. And the mental health challenges, it's not a silver bullet, but should have a multi-sectoral collaboration and interdisciplinary action to tackle the issue. And they work with the families and then healthcare professional build the trust and develop the strategies in the school level and the university level that can sometimes help to understand this concept. That's a really good question. And but here we don't have much that problem, but we have other problem here. So like alcoholism and drugs and the other things. Okay. Are there any other question? So if anyone want to access to our research team group, and then you can access to the UNIASA and a lot of resources available. Or if anyone doing research in mental health or education or any other, and please contact me. So if I can help, then it's in my capacity to do that. And I'm very keen to assist anyone if interested to study further. Okay, thank you.
Yes, Dr. Jayasekara, according to the Sri Lankan context, females are more prone to depression and mental issues than males. Like I think similar in the Australian context, I believe.
Yeah, I think that's true because that again the culture because they play important role. That's why the mental health strategy is a cultural aspiration, and here we consider both male or female. It doesn't really matter to make their own decision, and they have a balance of life, and we respect each other. And then I think it's in not only Sri Lanka but also most Asian countries, including India or Pakistan or whatever, and some of the countries, especially in other Pakistan or Middle East countries, they have a limited access to education, especially for females, and that create a problem. And that is the society they do. Only way to change that to educate the people and then understand the role and human being, and then I know the gender violence and it's a problem because it's continuing. It's only way to develop the policies relevant to that and tackle and give funding to implement the strategies and the research to find the way to improve the mental status of women. And that's why we actually ran the program to empower it's a postnatal depression, to tackle the postnatal depression with peer support group. So, I'm not really aware the difference with male or female in the, but the depression is highly prevalent in male in Australia. And also suicide is higher in male compared to the women. And that because of nature. And also we don't know exact numbers or details because the problem with underreporting, because of the sometimes the road traffic accident, we can see as a road traffic accident, but it may be suicidal and they want to commit suicide. They do this way, right? And we don't know. So the underreporting is the problem is huge. That is in Australia, mental health is considered as one of the top priority. They allocate funding to do research, do training program, do the implementation program, evidence implementation and strategy and separate institution to tackle the problem. It's not just research, but also how to implement. It's train specialist nurses, nurse practitioners, and the general practitioners, medical doctors, and psychologists. And then to develop that and also incorporate that facts to the undergraduate and postgraduate curriculum and also school curriculum. Is there any other questions?
Yes. Do you have any questions from the audience?
Yes. So I want to ask one question.
Yeah.
So that you have mentioned several strategies for overcoming the stress in among academics when we are doing the job. What are the alternatives that Metin for Sri Lankan? That what are the specific alternatives for Sri Lanka?
So that's why especially I think the academic work-life balance and the workload is I think key consideration. Here is the same problem because everyone have in the country has different things, but my understanding is in specifically the workload and also the work-life balance, because you consider you need to understand what are the factors that affect that mental condition, like the stresses and the challenges, and then how to tackle the situation. And if I understand your question correctly, especially to what strategies we can use to improve them and develop the appropriate model to work, and they allocate the designated activities for the academic. And you need to look after yourself and also to look after others. And as a group, you can develop this strategy. I can't tell exactly what to do things. First, need to identify what are the problems are. Then find the possible solution and then select a couple of solutions to implement it and check it whether it's work or not. So I think if you develop the workload model and allocate the reasonable workload to the academic, but I'm not sure with a lot of academics, it's moving from Sri Lanka to other countries, and then you may have another increase in your workload during this time. So the country-specific idea should come from your country expert rather than me, actually, that because of my understanding about your Sri Lanka situation is limited. But my understanding with the previous experience and considering the world view, I think that it's a systematic failure of the institution we work for. Right. It's not just one institution. It's a culture. It's a playing important role. And now it's the toxic culture everywhere. It's spread not only just for the academic life, but in every sector. And the day-to-day life that impact your work. If you come from the bus and the overcrowded buses and the pollution and the temperature of the country, everything affect your status, and then that you reflect in your classroom and the students and the peers and the superiors, and then that they become a toxic culture. But here it's different. We have air-conditioned buses and we have only few people on the bus, and we drive this to the city, and sometimes we park the car near and we walk and talk to the people. And we have very dangerous temperature and this approach in the summer, but other area and the environment also cause that problem. Is there no single solution? But I think you need to consider time management, stress reduction, and I think is to consider. And we practice, I can't exactly such it, but the meditation and is really help you to calm down your mental status, right? And then if you take that way, whether Buddhism and other beliefs, and I think as Buddhism is great opportunity in Sri Lanka because the majority of Buddhists, they know that what is that. So it takes time to look after. First, think about you and the happiness and the stress, whatever, it's your inside, not the outside. The problem people see outside, but not the inside. Some people see the problem as others, but not yours. Some actual problem created by pollution or whatever that impact your life, but you see that how to maintain your mental status during this difficult time. It's not the solution to migrate. I'm not saying that it's not too or bad, but and the same thing. Some people I know that they migrated to other countries because of the high tax in Sri Lanka. But compared to here, it's a lot of taxes, right? But they may have a different opinion. I can't say exactly.
Okay, thank you, sir.
Yes. Are there any questions? Yeah. Thank you very much again, Dr. Jayasekara, for impressive and informative presentation. You agreed to do this while you are not in good health. We thanks again you, and we wish
All right.
you to recover soon and achieve good health soon.
All right. Thank you very much for the invitation, and everyone have a good afternoon. And if you need any question or anything, please email me. Thank you.
Okay,
Bye.
thank you. Bye.
You